The entire country is outraged at the rape and murder of a young doctor, 31 years of age, in Kolkata. She worked at RG Kaur Medical College, and this heinous crime was committed by a civic volunteer. You all know about it. And it is shocking the way this criminal, Sanjoy Roy, after murdering her, went home and went off to sleep. Woke up at 12 and tried to remove the evidence from his clothes. But as luck would have it, the Bluetooth wire, which was found near the girl, was his, and that is what led them to him. This man was married 4 times. Three of his wives left him. One died of cancer last year. However, what has been unfolding after that is a series of happenings which are increasing the outrage. And now the Indian Medical Association has stepped in because it is important that our doctors are respected and they are safe. This particular criminal, Sanjoy Roy, was actually found extorting money from the patients at the RG Kaur Medical College. Why was he not removed from there earlier? How come he still had access to the hospital and college so easily? There is definitely something amiss. The principal of the college, Sandeep Ghosh, has resigned, but that is not enough. And the Indian Medical Association Nagaland State Branch, IMANSP, Nagaland In-Service Doctors Association, NIDA, and Indian Dental Association Nagaland State Branch, IDA-NSP, have declared withdrawal of all services except emergency from 6 a.m. to 6 p.m. I just hope that people get medical help when they need it most, but it is important that we stand for our doctors, and when they are protesting this rape and murder at this Kolkata hospital, then we stand with them. And while the healthcare services in Nagaland were affected on Saturday, with medics going on strike and protest against this heinous crime, the doctors did make sure that emergency patients were cared for and given treatment. And the withdrawal of healthcare services from 6 a.m. to 6 p.m. is what they restricted themselves to. The associations, just like all of us, have condemned the vandalism that happened at the hospital, and they have called for the removal of whoever is responsible for it and for improved protection for healthcare workers across the country. IMA NSP Honorary Secretary Dr. Aunong Tok Tushi Ao said that that they are standing with the IMA's call for this nationwide strike in solidarity with the protesting medics. And an official of the Naga Hospital Authority, Kohima, has also told the news agency PTI that the OPD, the outpatient department, was closed, but emergency services were operational. And that is where my information comes from. And this is an article in the print from which I gathered the facts. IDA-NSB has also empathized for the need of a safe working environment for all healthcare professionals, and that is something that all of us really do need to fight for. And the victim who's no longer there, the bereaved family, is in our minds, in our hearts, in our prayers. And members of the NIDA, in solidarity with the family members, wore black bands and badges to show their support and solidarity. It is horrible what has happened, but it is also necessary to speak up. It is necessary to speak up whenever something wrong happens, and this has not happened only in Kolkata. Kolkata has the Trinamool Congress government, but in Bihar, a similar incident has happened in Muzaffarpur, where the crime was so heinous that a small child was raped and murdered, and her private parts were struck at with a knife 50 times. It's horrible. I can't tell you more about what happened over there because it's really awful. A similar case has happened in Uttarakhand, Rudrapur of Uttarakhand, where a young nurse who was living with her daughter in a town which is bordering Uttarakhand and falls in Uttar Pradesh. And she was raped and murdered as well. And the accused allegedly comes from Uttar Pradesh but had escaped to Rajasthan from where he was arrested. What is happening in the country today? While we are outraged on one rape and murder, we forget the others. And the system which is working is shocking because very selectively it picks up one case from a state where you have a party which is not the BJP in power, and in other cases where the BJP is in power or they are in an alliance, we don't talk about them, like the Muzaffarpur case, like the Rudrapur Uttarakhand case. And mind you, the BJP is in alliance with JDU in Bihar. Muzaffarpur comes in Bihar. Uttarakhand, Uttar Pradesh, and Rajasthan. All three states are BJP ruled states. So there should be no outrage in those cases. Shocking, isn't it? Shocking. But you and I can put across what we want to say and stand in solidarity with these victims and stand in solidarity with all women and protect them and ask for a better society and for protection for women. I have always been very, very impressed with the way things are in Nagaland. When you are walking around the streets, even if it's evening time, you don't come across people looking at you or looking at you, glaring at you, which happens in the state that I come from. As we were growing up, we always felt that people were staring at us, and no matter how old we get, we still feel people's eyes on us, scrutinizing us, which is something that I really appreciated and really enjoyed while I spent time in Nagaland. I wish more people would respect women, but Nagaland can definitely, by speaking up against such incidents, can make people aware and bring an atmosphere of respect, safety, security for women across the country. Believe me, you can. But for that, you have to speak up. You have to stand up in solidarity with women and their safety and respect for them. What has happened in Kolkata, Rudrapur, Muzaffarpur are heinous crimes. Let us speak up against these crimes, the criminals, and any government which tries to protect them.